Well, good afternoon. Welcome to the Man to Man Live. Today, we're going to be talking about men's health, men's general health, and week one of that. So we want to make sure that you go ahead and like, share, and tag a friend today because we're going to talk about a dynamic topic today, men's general health. I have a distinguished panel on the broadcast today, so I'll let the gentlemen introduce yourselves.
Hi, my name is Daniel Myers. I'm an LPN by trade, but I'm an MAT HUD program director for Caresouth Carolina.
My name is Mark Calhoun. I'm the Director of Social and Community Services for Caresouth Carolina.
My name is Daniel Blathers, Intervention Specialist with Man to Man Florence.
And I am Terrence Turner, Data Quality Manager with Man to Man Fatherhood Initiative here in Bennettsville, South Carolina. So today we're going to be talking about men's health, and this is a very, very important topic today. So if you know a father, you know a brother, you know an uncle, you have anybody that's a significant other in your life, any man that you need to make sure they get this information, go ahead and tag them in the comments. Go ahead and like, share, and invite them. Let them know that we are on today. So with that being said, I'm going to turn it over to one of our strategic partners, Caresouth, as we dig into this topic of men's health. Take it away, gentlemen.
All right. So yeah, this is a very important topic, men's health. You know, it's one that we need to have more conversations around because we understand that men are the last one to seek any type of health care, right? Because we have this thing called pride and this thing called machismo. We're too macho. But today, we want you to learn some very important things. So some of the objectives are listed right here on the screen. We want to increase your awareness of the special health risks that face males, discuss symptoms and risk factors for top disease among men, discuss mental health, which is a big thing with us, okay? Especially depression concerning men. Explore the attitudes about using health facilities, communicating with your healthcare providers, and taking preventative measures to avoid even getting a disease, okay? We want you to be able to enhance your ability to communicate comfortably and effectively about your health to whoever, okay? Explore behaviors and lifestyle choices for a man to stay healthy and explore the fatherhood connection concerning health and paternity issues. So we go hit some key points in this discussion today. And if anybody got any questions, please go to your chat area, put your questions in there, you know, and let's have a discussion about men's health. Next slide. Okay, so here's some of the hazards of being a man. The death rate for cancer and cirrhosis of the liver is 2 times higher for men than women. Okay, the death rate for heart disease is 2 times higher for men than women. Men with ulcers are 2 times higher than women. The death rate within few years of divorce or breakup of a similar relationship is 3 times higher among men than women. Next slide. So on the previous slide, you notice that we are at the top of the scale when it comes to our genders for being exposed and be a predisposition for anything. So being a man is already a risk factor. Okay, so men are 3 times more likely to be murder victims than women. Successful suicides 3 times higher among men than women. Men are 6 times likely to have on-the-job accidents than women. Men are 13 times more likely to be arrested for drunkenness than women. Let's stop right there for a minute. These numbers are extremely high for the risk factors for men. So, like I said, being a man in itself is a risk factor because first of all, let's talk for a minute. Let's be honest. Men don't like to read directions, do we? If we get a power,
no, we don't. We don't.
Right? So we watch YouTube. We go to Harbor Freight and buy a power tool. They give us instructions, and in those instructions it says safety, right? We throw the book away and we remember what our uncle used to do, and we do what they did. Okay, so that's why our risk factors are higher because we are risk takers. Okay, and just this in itself is an example of why we are at risk for health risk. Okay, 13 times more likely to be arrested for drunkenness than women. Why? Because men never get drunk. Even when we're drunk, we ain't drunk yet, right? We can always, right? So long as they have alcohol on the table, long as it's there, we can drink it. All right. Yeah. So we have to start monitoring and curtailing our behavior around our lifestyles, and this will reduce our likelihood of any of these incidents being any higher next year. Okay, so today is the day that we start curtailing our behavior and our lifestyle. So let's go to the next slide.
Mr. Myers, before you go to that next slide, sometimes as men, we say things like this. Well, I figure it out. Why is that not a wise choice to make when it comes to our health?
Because we can't figure it out. We don't have, okay, none of us went to school. I haven't gone to school to be a doctor. Okay, I went to school to be a nurse, so I can't diagnose, right? A doctor can diagnose because they have the ability to diagnose. We don't. But men feel like if you got it, if your toe was green and you had sock toe, my toe green, so I got sock toe too, right? So we become doctors in the barbershop. We become doctors at the garage, or we become doctors in the backyard barbecue. And so we cannot figure it out because we don't have the ability or the mental capacity or even the education to figure it out. So that's why we go to somebody who's more qualified to know our health better than us. But if you look behind me, even in saying all of that behind me, it says that every person is responsible for his or her own health, right? So in being that responsible person, you have to know who to go to that have the authority to tell you what's wrong with you. So let's stop trying to figure it out and let's find somebody who knows, and it will have to be figured out. We'll know automatically what's going on with us, right?
Hey, Tan, I think one other thing with that is, growing up as boys, we're always taught to be tough.
Yes,
Suck it up. You'll be all right.
Yep.
And for some, that carries over into adulthood. You might have an ache, I'm put some salve on it. I'll put something on, take some aspirin, some Tylenol or something like that. But you grew up with that mind state. And now that you're an adult, you just feel like, man, I'll be all right. I'll tough it out. Well, toughing it out later on in life is gonna be the part, because now something you should have got treated 20 years ago is gonna come back when you 40.
Right. That's right. And good thing you brought that up, because it brought me back to something that happened to somebody I know in my family some years ago. They stepped on a nail. We was tearing down the house and they stepped on a nail. Okay, now everybody know with modern day medicine, if you step on a nail, there's a possibility of contracting tetanus, right? Or we call it lockjaw. And so what this person did was they listened to their uncles and their grandma, and they put some fat back along with some moss around that wound and wrapped it up and put a sock on, told them, go on about your business, you're gonna be all right. Well, later that person developed gangrene, okay? And that person ended up losing that foot because they failed to seek care. Because we're so used to listening to old remedies, and we're raised with that we don't want to seek health care. But we're going to discuss why that is, because, well, that we don't trust the healthcare system, right? Yeah. And there's a lot of history behind us not trusting the healthcare system. But over the years, our healthcare system has improved. So we have people that practice medicine that look like us, that look like everybody in the spectrum. So if you can't trust a doctor that you're going to, find one that you can trust, that you can go and share your medical information with, problems with, and that should really help us out a whole lot more. So I agree with you. We're brought up thinking a certain way, but we have to change that mindset. Okay. Next slide. Okay, men have 2 times more fatal accidents per mile than women. Why? Because we can handle it, right? We can handle it. We can figure it out. If we're doing 100 miles per hour on a wet road and the car start to slide, we can figure it out. All right.
Man, I got good tires.
I done did this last week, right? Right. But every situation and every circumstance is different. So if we dodge the bullet on the first time, then what's the chance of us dodging that bullet again? Few and far between. So, but once again, we're risk takers, and that's why our numbers are high when it comes to accidents. Whether it's in the workplace, in the streets, or in our homes, we're more prone to accidents because we already know it all. We're walking encyclopedias. We know everything about our health. We know everything about the risk factors. Okay. Now listen to this. Women, on average, in the U.S., live 5 times longer than men. Why? Because women are concerned about their health. They seek care. They talk to each other. They communicate about their health, and they are not risk takers. And when it comes to suicide, women are less likely to die from a gunshot wound because they're not familiar with it. Okay, so that's why. So we have to be a little more we have to be more in touch with our feminine side, okay? But when it comes to this, because if the women are living longer because they are concerned about their health, then we can live just as long as we have the same habits and the same lifestyle that they have when we're concerned about things, okay? Now listen at this, and this is going to get real deep. Men are 7 times more likely to have AIDS than women. 77% of new HIV cases in South Carolina are men for year 2015. We know that that number's changed in the years, okay? We're in 2020 now, so I hope hopefully by next slide we get a little update on that. But why are men more likely? I'm gonna ask the fellas on the panel because y'all are men and y'all know why this is so, okay? So why are men 7 times more likely to have AIDS than women? It's the same
They
phrase.
being players.
Huh?
You know, being players, trying to be out there, you know, sowing your oats in different places, not looking for love or not trying to settle so much. So, I mean, that's just an honest opinion.
And
What
also,
about, go ahead.
also, when it comes to condom use, hey, I can't feel it. When I wear that, it feels better without it. It's, again, that risky behavior that you talked about.
That's right. That's right. And so we are less likely to use preventative measures, safety measures in anything that we do. We don't want to use seat belts in the car. We don't want to read the instruction when it comes to power tools. And we don't want to use condoms when it comes to having unprotected sex. Okay. So that's why our numbers are higher. Once again, we're risk takers and we have risky behavior. And that's just part of our nature. Okay. As men. Okay. Next slide. Okay, so why do you think men living in the South seem to have a higher rate of disease and early death than other men in the U.S.? Why is that? In South Carolina,
Eating habits.
our eating habits,
Yeah.
right?
Yeah.
Our
Absolutely.
eating habits, and so a lot of our eating habits lead to certain diseases that put us at higher risk for mortality. Okay, so we have to be careful about our diets. Of course, we were raised. All of us are country boys, right? Everybody, country boy.
Yeah.
Yeah.
You're a country boy. Raise your hand.
Oh yeah.
I know I am.
Sure.
All right. So I was raised with my parents had a farm and we had hogs on that farm, right? And about this time of year, we would start storing our meat up. So we would kill those hogs and we would eat that hog. And so is there anything wrong with eating pork? No, but things that we do need to be doing in moderation and how we prepare it. But our diet in the South consists of high fats, fatty foods, preservatives, nitrates, which come in our meats, like our deli meats. And so it increased our chances of different diseases, which leads to early mortality. So we have to be careful about our diet living here in the South. And I find this as an embarrassment, when I look at the entire world, and South Carolina is at the top of the list for men. So there's a lot of education that needs to be done around our diet and our health as men here in South Carolina. Next slide.
Wow.
Here we go. This is the possible reasons right here. We just talked about all of them. Okay. Cultural factors. What we eat. More fat, more fried. Okay. Now the only thing I like better than bacon is bacon wrapped in bacon. Okay.
I know, right?
and that's our mindset. Okay. If a little bit is good, more is even better. All right. That's not so when it comes to certain things. Okay. And how we accept people. Okay, so look at our culture, and there's nothing wrong with what I'm about to say. This is how I truly feel. If I see a woman that's a little overweight, what they call overweight, but to us she's what? Come on, y'all, tell me.
Big bone
And thick, right? So right. So we view obesity different. To us, it's a big, it's a good thing. She's healthy. She eating. She can cook, right? And so then the other cultures view it as if you're not at this this index, this fat index, then you're obese and you're overweight or you're morbidly obese. And so they want you to look like bones. Well, we want you to have meat on those bones. So we view it different than most cultures, okay? And that's how we do, okay? So we don't look at fat as being unhealthy. We look at it as being attractive or a sign that this person knows food or this person eats well, okay? Then we have to change our mindset, okay? And then we talked about this earlier. our lack of trust to the healthcare system. The Fatherhood survey shows distrust of medical professionals. It does, because for you, if you look at our culture, let's go back to the Tuskegee experiment. Okay,
Right.
how
Yeah.
black men were denied treatment for syphilis. Okay, and so even that, even in that, just that one instance right there, if people hear about that, how the government used us as an experiment to see how syphilis can really deteriorate our bodies and send us to early death, that makes us distrust them when it comes to them taking care of our whole health. So we
Wow.
don't trust people in white coats. All right. And think about it. Up until recently, there have been more people that didn't look like black men in the medical field as providers, right? And so the majority of our healthcare providers were white males or white females. And so we didn't trust them with our health because they don't understand our culture. They don't understand our language. They don't understand my diet and understand my finances. So how can I talk to them about my health? Okay. And like I said before, if you don't trust somebody or you don't have confidence in somebody who's taking care of your health, find somebody that you can trust. But get your health care needs met at a place that you feel comfortable getting it done. Okay. Somebody got something to say?
Yeah, Daniel, I was going to say, just kind of to that point that you're talking about here recently. We're talking, that resonates right about now, because you seen yesterday for Pfizer announced the potential of a COVID-19 vaccine that is has an efficacy rate of 90% being effective. Yeah,
Right.
and so that's going to play in here soon. Here soon when they start rolling out, possibly here before the end of the year, targeting most vulnerable adults and healthcare workers, and having that vaccine available, and then to the general public, having it available potentially early part of the spring in April, May. So
Right.
that's going to play a whole lot of a huge role. What you just mentioned, and when that vaccine come out, how many folks are going to be entrusting enough to take that vaccine?
Not
You know,
many, for two reasons, Marek, for two reasons. One, because you have to look at the ratio of how many people in our culture were used in the study. So how did that affect us in that study? So the study shows an overall success rate, but it doesn't do a breakdown on ethnicity, right? So it don't say it's 90% effective in black people. It said 9% effective. So you're going to take the best number out of those people who were affected by it, and that's what you're going to present to the public. You're not going to say, well, out of that 90%, all the African Americans that we had involved in this study, it was not effective on them. Because why? That number is so small, it wouldn't make a difference to that 90% if that 90% was Caucasian or another race. Okay, so we have to be careful on whenever we look at all these studies. We have to go and read the deep details about how this study was done.
absolutely.
So it's very important that we become more educated and that we read more about anything that's coming down the pipe, especially now with all this rush that's on getting this vaccine out. Of course, all of us won't cope, and this is something it's a slide they added later on, so I guess we can discuss it now since we're here. There's a push now for scientists to develop a vaccine to help get rid of this COVID-19, and all of us we want to get rid of it. Because look, I want to go to Longhorns and sit down and get me a steak, and I want to eat it with my mask in the car and not nowhere around me. Okay. I want to be able to go out and just enjoy being with my family out in public with no mask on, because I'm tired of looking like a little mad bulldog with a muzzle on everywhere I go. I know y'all are, right? Everybody like little bulldogs, right?
Yeah.
So we so they're pushing real hard for this stuff to change. And so what gives me a little what set me back a little bit is how fast you are doing this, and what's the safety features or safety aspects of what you're doing. Speed is not always the best thing. I'd rather for you to go and find a couple of years getting something done than you to speed and do it, and it destroys my health later. Okay, because we still don't. It's too early to see the side effects of this medication. It's too early to see the side effects of what happened after COVID-19. So I think all this should be taken in account whenever we're doing a study on immunizations or any foreign object that I'm putting in my body that's supposed to increase my wellness. This, like I said, Like the sign says, every person is responsible for his own health. So you need to take into account whenever you decide to take something, how is it going to affect me later?
And I think one thing that's important in terms of what you're talking about now, in terms of the COVID shot, a lot of people are less hesitant to take the regular flu shot right now because they have fear which one you trying to give me, or are you trying to test something on me? And now they're not even taking the regular flu shot. So here it is, it creates more of a risk factor going forward through the winter months.
So which leads us back to lack of trust, right? And so that's not only with men now, that's covered, men and women. People are not trusting because you putting this information out at the same time you're asking me to take a flu shot. So what does that flu shot consist of? It's, like you said, are you using it for the experiment like Tuskegee to say it's going to affect me? I don't know, so I'm not going to take it. So it's a lot of things that we have to take into account when it comes to our health. And this one is very important. Poverty, less educational opportunities, and inadequate medical insurance. All these things go together. Because first of all, if I don't have an education, I can't make my money. That's going to keep me 200% below the poverty level. Okay. And then I can't get insurance because the job I got to work on the farm and then work up at the table because I don't have education to fill out the application. Okay. So all those things put me on the back burner for getting my health care taken care of, because if I got poverty, that means I got to work, right? If I don't have an education, I got to take those jobs that that put me at high risk for injury or disease, okay? And those jobs at the same time don't pay enough for me to have to get insurance. I have to make a choice. Either I take care of my health or I take care of my family. And what's going to win every time?
Family.
So my health takes a back seat, okay? And which is not a good thing. And
another thing about that as well, you talked about that education piece. Without that education, you can't make an informed decision. So you're gonna have to trust, like you guys were saying about them rushing that vaccine to the market, right? Without having the proper testing, things of that nature, probably for financial implications, things of that nature. But if you don't know, you're not well versed, and you're not well informed, you can't read and decipher and discern what information is true and what best decision to make for yourself without education. Can you speak about that a little bit? Well,
okay, so say for instance, there's a lot going on right now around wearing the mask and how it protects us from COVID-19, right? And so a person who's not educated, they're more apt to take hearsay information because they can't read and interpret medical documentation. And so with the current administration, speaking about masks are not necessary, that they don't work, they don't do anything, look how many people are not wearing it because they listen to him. And listen, a lot of votes that he got was votes that came from uneducated white males. Okay, so it's not only in the Black community that education is low, but it's in every community that you have a lack of education. And a lack of education leads to what? Bad decision making. Because if I can't read and interpret, then I can't make an informed decision. So instead of me trying to go through all those troubles, I'm gonna just take what you said and go with it. Because you know what you're talking about, right? And so it's very important that our men, and it's never too late to increase your education. It's never too late to go back to school. It's never too late to get as much knowledge as you can get. And I always have to bring the Bible into it because I'm a preacher first, okay? The Bible says that those who want wisdom, if you ask for wisdom, he'll give it to you liberally, which means he makes opportunity and resources for you to learn more and obtain more and grasp more. That way you will know more and you will do better. So all that applies to our health as well. It's spiritual, but it applies to our natural life as well. So we should have a hunger for knowledge the way we have a hunger for these fatty fried foods that we get. I got a doctor that worked with me that don't eat pork. And I told him I don't either, not unless it's wrapped in bacon, right? So it's just understood, right? So but we have to make sure that our young men and young women are educated when it comes to their health. What's good for them? What's in their best interest? Not what somebody else said. Because our bodies are different. They look similar, but our bodies are totally different. That's why we have a different genetic makeup, right? Because we're different. If everybody was the same, then we'd be clones. When my head hurt, your head hurt at the same time. but we are different, and we have headaches for different reasons. Okay, and so one of the reasons that we can have a headache, or any other thing, is because of possible unhygienic situations, which goes back to our bullet point ahead: poverty. Okay, we don't have enough money to have cleaning supplies or even running water or inside plumbing in our house. Okay, so the first barrier to any disease process, the first thing that protects us is our skin. That's why hand washing is so important. Okay, because the skin is the biggest organ of our body, and it protects us from any outside organisms getting into our body. But if it's not clean, what happens? It opens up an opportunity for parasites, funguses, sores, things that breaks that barrier, that makes a portal for diseases to come in. And so now we become host to viruses, to the flu, to anything, because we're not clean. So wash your hands, okay? That's the first protection against any disease, is hand washing. And how do I know that? Because I just had to do that on one of our Reliance trainings that we have to do. That's mandatory for us. So that's right at the forefront of my thought right now. Dangerous and stressful living arrangements. How can my living arrangement be dangerous? How?
Well, one, like, again, based on where you are, you know, if there's not running water, or if there's not, you know, proper heat and ventilation, you know, or even the outside environment, you know, whether or not it's a high crime area or things of that nature. So all these things play in the factor of where you at.
That's right. That's right. And so what about now? With everything that's going on in our communities, I live in Dillon County, right? And some of the areas in Dillon County have become war zones where we got the different gangs fighting against each other. Okay. And so that's a dangerous and stressful living arrangement, because there's always shooting going on. Right. And what's bad about that is that it's so common that it don't even faze people no more. Usually when gunshots ring out, what usually happens?
People ducking and running.
Now people looking to see where it's coming from. Right? And that's not our nature. Y'all know how it was when we used to watch horror movies back in the day. We was the first ones to run, and we asked questions later. Right?
Yeah.
When Jason was coming, we left, and then we asked him what we running for. Okay? That's not the case anymore, because we become numb to the violence. Right? And we also become numb to not being able to afford proper home maintenance, and we're doing it ourselves. We'll figure out wiring. Right. We'll figure out how to make this thing work. Okay? We don't have enough extension. We don't have enough outlets, so we'll put 12 extension cords together, and we'll run our stove and our refrigerator, our air conditioner, and our PlayStation off of. Okay? Wow. Those are dangerous situations. And what makes it stressful is that we don't have the money, the income to do any better.
Yeah.
Okay? Or the resources. Okay? Smoking. In 2017, 20% of South Carolina adults smoke. We know that number is a little bit higher now. It's a little bit higher, but it's still not as high as it could be, because now we have the smoking cessation program, which helps as an intervention to smokers to help reduce our risk of heart disease, any cancers related to smoking, which is smoking is the #1 cause of all cancers. So that's improving. Let's go to our next slide. Top killers of men in the U.S. Like we just said, heart disease. Why? Because of our diet and because of our lack of medical attention, right? We don't pay attention. Blood pressure is called what? The silent what?
Silent killer.
Silent killer.
And that's the thing that takes most of us out, okay? Our blood pressure, because we got a headache, we go and get us a shot of vinegar. Have y'all heard that before?
Yeah.
Get some vinegar to lower your blood pressure. Put some moss in your shoe. Bring your blood pressure down. Okay.
Wait a minute. Say that again now. Are you serious?
Yes.
Oh, yeah.
You ain't never heard that?
No, I never heard of that.
Yeah, man. Get a sip of vinegar or put the moss in your shoe. It'll bring your blood pressure down. Okay. No. Going to see a doctor, find out why your blood pressure is high in the first place, and get no medications to treat it will bring your blood pressure down. We can control hypertension. Okay. We can actually reduce heart attacks or congestive heart failure. Okay.
You can't take a shot of vinegar after eating bacon.
Sure, no, that's the bacon first, the salt and vinegar bacon, right? All right. So it's important that we know we know our numbers. Okay, all these things that we're going to talk about is knowing your numbers. Okay, cancer, lung cancer, prostate cancer, colorectal cancer, pancreatic cancer, and liver cancer are real prevalent amongst men. Okay, and we know that cancer amongst men are at a higher rate because we saw in earlier that we're 2 times more likely to have one of these diseases because of our risk factors. Because of number 3, we're risk takers. Okay. Okay, it was a thing that was sent to me about cancers, about the signs and symptoms of cancers. There's 7 warning signs of cancer. Okay, it's changing bowel or bladder habits, a sore that does not heal, unusual bleeding or discharge, thickening or lump in the breast, testicles, or elsewhere. Okay, indigestion or difficulty swallowing. Now, every indigestion and every difficulty swallowing is not a sign of cancer. Sometimes you eat too fast, you can't get it down fast enough. Okay, indigestion can come from you eating fatty food or eating something that's real acidic and is affected by your sulfuric acid buildup in your stomach, and it causes reflux. Okay, so that could be a problem. But either way, we need to get it checked. It's an obvious change in size, color, shape of a thickness of a wart, mole, or mouth sore. Okay, a nagging cough. Now we know we're dealing with COVID, right? So how many of these symptoms just sound like COVID? Okay, we got a few out of there, right? So it's always good to go get a second opinion about what's going on with you. Okay, but the more serious symptom that we need to look at, and some other symptoms that we need to look at is coughing up blood, persistent headaches, okay, unexplained weight loss or appetite, chronic pain in the bones, persistent fatigue, nausea, or vomiting, persistent low-grade fever, either constant or intermittent, okay, and repeated instance of infection. Okay, so those are some of the signs and symptoms of cancer that we need to look after. And so, like I said, a lot of these things look like other issues that we can deal with. They have similar symptoms as diabetes, heart disease, stroke, respiratory illness. So all these things go together, but how do we know exactly what it is? We can't figure it out. So we have to go to the people who are professionals who do this for a living and let them find out what's going on with us through testing, through blood testing, through x-rays, or through questionnaires to find out what's going on. Our family history plays a big part of us contracting these diseases, because we might have a predisposition because of our family history that causes these things. That is a big thing in our family. So like heart disease or stroke. How many people in your family die from heart disease or stroke? Any of you guys? Anybody?
It's been a 1 or 2.
See, so with me, it's a predisposition that could possibly happen to us or some of our people that's watching. Somebody in your family has something that's going on. We very rarely find people that don't have anything. Now, there are some people who have no illness, okay? But those are very few. Next slide. Okay, risk factors for earlier death and chronic diseases. Poor diet, okay? We talked about that already. Overweight. Okay, we talked about that already too. Uncontrolled high blood pressure, we talked about that too. And then my favorite, which is my specialty, substance abuse, including alcohol. Okay, those lead to an early death if they abuse, especially substance abuse, especially right now. There's a big increase on overdose deaths. So we just need to be careful. Next slide. All right, so fellas, be honest. If we had this in the cafeteria, what you gonna eat?
I'm going with the one on the right.
Yeah.
Which one? Okay, which one is that? Because my right might be your left. Which one is it?
The grill.
Who's going with the grill? Who's going with the grill and salad?
That's me.
Look, today
I am not wasting my money on that when I can get some chicken and rice and corn.
in today's world, it's gonna be on the right.
It's gonna be on the right.
My mind's telling me the left.
Okay. So your mind telling you the fried chicken, right?
My mind is telling me the fried chicken. My conscience is telling me get the vegetables.
Okay. All right. Which one you gonna get?
Hey, I'm like him. I know what my mind gonna tell me, but my stomach telling me that chicken and that rice and that buttery corn right there looks good.
Yeah. Yeah, especially if I got $5 and I got to eat and I got to get food. Right? That's all I got. I got to get a drink, I got to get something to eat, and I got to save a couple dollars for gas. What am I going to get?
That chicken
the
is
one on the The one on the left is cheap. The one on the right is gonna take all your money.
Exactly.
That's right.
Exactly. So I'm going to eat what's cheaper. Am I right?
Yes, sir.
And that's a problem. That's a problem. That's why we're more apt to go to the deli part of a grocery store when we have a low income, because when we get things that's going to last and things that's cheap, right? We can go and get a couple of cans of Spam or something, and that's going to give us a couple of meals. So we're going to eat not healthy, but we're going to eat to survive and not eat to live. You understand what I'm saying? Absolutely. It's a difference. Okay, next slide. Go ahead,
and for the point on that, I was always taught when you go grocery shopping, you shop at the outer aisles first, because that's where the more healthier items are going to be.
That's right. That's right. Around the perimeter.
Yep.
Around the perimeter. If you go in the middle aisles, your money is gone, and you haven't got a healthy thing in your buggy. Not one. Okay, so we've learned to go to the fruit and vegetables first, right?
And one other part of that is don't go hungry, because you end up buying stuff you got a taste for right then.
You must have been talking to my wife, because
right.
If I go in and she's fine, I'm buying the one that ain't made up yet, because I'm hungry. I want to know what I get right now, and all the things I missed that day, I want to go ahead and get them in that buggy. So you're right. Make sure that you are full and that you ate a good meal before you go grocery shopping, and you're less apt to do what they call impulse shopping.
Right.
Okay. Because your stomach tell you, hey man, go and get them chips. Get them chips. Go and get them chips. We can get them right now. We eat them right now. Don't listen to your stomach. Listen to your mind. Okay. Okay. Smoking. Smokers died 13 to 14 years earlier than non-smokers.
Wow.
I used to smoke.
Wow. Wait a minute. Can you say that stat again, sir?
Smokers died 13 to 14 years earlier than non-smokers.
Wow.
So that means if I'm dating a girl with the exact same age and I'm dating her, okay, she's a non-smoker, I'm a smoker, I'm going to leave her at her prime for somebody else to get. Right? Because I'm leaving her 13 to 14 years earlier than I should be.
That's right.
So I used to smoke years ago, and I've been smoke free like a restaurant. I've been smoke free for about 18 years. Okay, and in that, just in that time, I've got the color back to my lips. My lips used to be black, right? I got the color back to my gums. My gums used to be black. So my fingertips used to be black from smoking. I didn't smoke chronic. I didn't smoke loud and mid or Reggie. I smoked Newports. Okay. So imagine how many changes came to my lungs because I stopped smoking.
Right.
Okay. I couldn't gain weight because I was smoking, because somebody said, man, don't smoke on your stomach. So I would go and get a pecan. Okay, just so I can smoke a cigarette, because I want to smoke more than I want to eat. So, but after I stopped smoking, I was able to gain weight and look like somebody. Okay, so stop smoking. If you want to live, stop smoking. Smoking is the leading cause of all these cancers, so don't do it. Poor oral health. Yeah. Okay, you cannot have good health without having good teeth or good gums, healthy gums. Why? Because you can't eat if your mouth is hurting. You can't eat if your gums are diseased, right? And also the disease part of if your mouth is diseased, it can lead to heart disease. It can lead to infection to your heart. So we need to be careful about our oral health as well. Okay. They said it's linked to some cancers and heart disease. Not being safety conscious. Well, we might just throw everything else out the window, because if we don't get this part right, then it don't matter about the rest of the stuff. Am I right?
Right.
If we don't learn controlling our speed on a motorcycle, helmets. I'm a motorcycle rider. I love to ride my bike. And I was with my wreck this weekend, and twice I was almost in an accident. But if I had been one of those careless riders who just rolled wide open and didn't stop, and didn't pay attention to my surroundings or won't safety conscious, then I wouldn't be here today talking to you guys. My family would be doing some sad things of flower bringing right now. Okay. Okay. But because I got a feedback, y'all.
Yeah.
Because I understand that, and I understand that it's important for me to be safety conscious. Warning signs for heart attack. Back up my warning signs for heart attack. Let's go there. Okay, so if you're having a heart attack, how do you know you're having a heart attack?
Sweating.
Yeah, sweating. What else?
Mm-hmm.
Left arm pain.
Yeah. What else?
Nausea.
Mm-hmm. But suppose none of this stuff happened. Suppose you don't feel any of this.
Jaw.
Right? So is it guaranteed that you're going to feel all this stuff before you have a heart attack?
Oh no.
No.
Not necessarily.
No, this is a possibility what you can feel. Okay. Suppose you got two of those. Suppose you got burping and suppose you got sneezing. Suppose you got a heart attack. I mean, suppose you got a heaviness in the chest, but it's flu season, it's cold season.
Right.
You're gonna put that together with a heart attack? The best way to avoid a heart attack is to go to the doctor regularly and have your cardiovascular health checked through your blood work, through EKGs. Okay, knowing your numbers, knowing what your blood pressure is, knowing what your cholesterol level is. Okay, and that way know your body. What I'm trying to say, if you know your body, then you'll know something ain't right.
Dane, how often do you recommend going to get those screenings?
Huh?
Say again.
Repeat that. Repeat that. Could you repeat that question?
How often do you recommend going to get those type of screenings?
I tell you, we're gonna get there just a minute I'm gonna give everybody a record of how often you should go. But I think you should go annually.
Okay.
Annually for your physical exam, but every 3 to 6 months if you're diagnosed with one of these issues. Why?
Gotcha.
Because you don't get your prescription filled. If I was a doctor, I'm not gonna fill your prescription if I don't see you. Okay, because I didn't know what your numbers are before I give you more medication. Suppose you just had an episode of diabetes. It wasn't you're not a diabetic, but all of a sudden now your blood sugars are good because you changed your lifestyle. If you don't come in a year, you're taking medication you don't need, right? So I say every 90 days, 6 months to a year, you need to be going to see a doctor. Okay, if you can't do those first two, at least annually for an entire physical workup. Okay. The other important thing that we face a lot as men, especially African American men, is strokes. Right? It's because of our diet, because of our risky lifestyle. Once again, because of heart disease, because of our just we don't want to seek help. Okay. So what's the status of a stroke? Okay,
Yeah.
sudden numbness. Go ahead.
Numbness.
Like you say, just seeing the numbness in the face, our arms and our legs. A lot of times we are taught that's the first sign. If throughout time or family members teaching that. So, but as you know, there are other signs, like you say, with the confusion, the trouble speaking, dizziness, walking, loss of balance, severe headaches with no known cause.
And that's the main thing right there. That severe headache. Because how often do we have a headache?
Oh man.
If we just go and take that 40 go about a minute, we'll say it'll be all right. I'll be all right. I'm good.
Mm-hmm.
Okay. So that could be a dead giveaway that I'm having a stroke, but we don't know. We don't know because we don't know our numbers. We don't know our body. Okay. So and knowing our numbers, our blood pressure is very important. Your systolic, which is the top number, should be less than 120. Okay. Your diastolic, which is the bottom number, should be 80. Now some of those numbers fluctuate, depends on what medical guide you look at. Okay. So to me, a high blood pressure is 120 over 90 or 130 over 90. It's borderline hypertension. Anytime your numbers get that high, then you need to be watching your diet, checking with your provider, see what you need to do. Okay. Elevated blood pressure of 120 to 129, systolic less than 80. I mean, come on. I feel like anytime our numbers are out of whack, that's why you got to know your baseline. And how do you know your baseline? By going to the doctor regularly, knowing what your blood pressure is every time you come there. Okay. If it's high, get no medications, let them bring it down to a baseline number. And that number exceeds that baseline, then you need to be more concerned about your numbers. And how do we control those numbers? By watching our diet, okay? Weight reduction, reduce our sodium intake, more physical exercise, stop smoking, okay? And a moderate use of alcohol. Next slide. Diabetes, and what we call in our community sugar, okay? Which is okay, we call it sugar. So which means it's the amount of sugar that's in your body that the insulin didn't absorb. Okay, insulin goes to the pancreas produces insulin, which reduces your sugar in your body, which keeps you from having diabetes. Sometimes our pancreas don't work. Sometimes it works inefficient. And so you have two types of diabetes. You have diabetes type 1, which means that you have no insulin production, or you have diabetes type 2, which means you have an altered state of insulin production where it's not producing enough. Okay. And so what the signs and symptoms is: increased thirst, hunger, dry mouth, frequent urination, unexplained weight loss, fatigue, blurred vision, headaches, and loss of consciousness. Now, all these symptoms are gonna sound just like the next disease. So that's why we got to be careful and know what we're doing. Okay. We just talked about the coronavirus. This is flu season. They have the same symptoms. So how do we know? How do we know what we got? There's free testing everywhere. Okay. And since it's been going on, we've lost over 220,000 people to coronavirus, more than that now. Okay. And it's a disease that's spread by droplets. That's why wearing a mask is important. Droplets means that there's a spray that come out of my nose, out of my mouth, that's from 3 to 6 feet. Okay. And sometimes it can also be airborne. Airborne means it's traveled further than 6 feet. It can go further. So why is it important that we have a mask on for coronavirus? Because a mask protects those vulnerable areas that we can ingest that disease, which is our mouth and our nose. Also, our mucous membranes when it comes to droplets, because they go in your eyes or in they said sometimes that people's contracting from their eyes, because when people talk or people sneeze, your eyes are wide open and those droplets go right there in your eyes, right? You might wipe your face off, but you can't wipe your eyeballs off. All right. So hand washing is very important, and wearing your mask is very important when it comes to COVID-19. Okay. Depression, brain health. Let's go. You go ahead, Moret. Mental health, how we think, how we feel, and how we behave. Okay. How we think, how we feel. Okay. Mental health disorders, most common type, mood disorders, including depression, anxiety, and schizophrenia. Okay. Now, depression can be situational, or it can be back up one time, Moret. Back up one slide. It can be situational, which is like one time. Or it could be chronic, which means it's ongoing. So we just need to decide what's going on with us. Go ahead, Marie. Okay. Signs of depression: fatigue, sleeping too much or too little, feel bad physically, chronic stomach ache, backache, irritability, frustrated, hopeless feeling, difficulty concentrating, anger or hostility, feeling stressed, anxious, consuming too many substances, sexual dysfunction, or indecision. Okay. Still, those symptoms still coincide with our physical health as well, right? So our mental health, without good mental health, we can never have good physical health. So our mind and our brain have to be functioning properly for us to know to take care of our body. Okay, next.
Can I back you up 1 second on that?
Yes, you can.
I know one thing about, as far as men, we are less reluctant to go seek mental health. We're not used to talking to people about internal things that's going on with us, much less even the outside to seek help with that. But growing up, you were taught not to express yourself, and we tend to hold in so many different things that over time we don't know how to get it out, or if you try to express yourself to your friends, they go look at you, oh man, you soft. If you talk to a woman, you too much in your feelings. So a lot of times we don't get it out unless, oh, I'm going to drink with my boys and then I'll say whatever while I'm drinking, but then I'm adding something to it, which is the alcohol.
That's it.
So we never get a chance, throughout life, a lot of times to express what's going on with us because we don't want to be viewed as weak or thought of as crazy so much that it's a long-term process. And with so many things going on around us, like you say, you can be in a bad environment. You see a lot of killing in the street or violence and stuff like that, but you only suppress it. But then when it comes out, it don't come out right.
That's right.
Mhm.
Check this out now. You brought up a good point, which is something that we're fighting against here at Caresouth, and we have a campaign against, which is destigmatizing mental health care. Okay,
Right.
removing the stigma around it, and so we need to start doing more talk about it's okay to talk to somebody. Okay,
Mm-hmm.
about how we're feeling. That's okay because there's people who are trained to help us with the issues that we're going through mentally. Okay, we already found out that the barbershop can't do it. The barbershop, believe it or not, barbers are your first counselors because you would tell your
Mm-hmm.
barber more than you would tell your wife or your brother.
Right.
Okay, and there's more advice given in a barbershop that's given in any podcast in America. Y'all believe that?
Yeah.
Yep.
Because men would go there and they would share their stories, but it won't be them. I got a cousin that
Mm-hmm.
felt something, in his testicles. What
Yeah.
y'all think going on there? Okay, and so
Mm-hmm.
that's the first step. That's the first step to getting your mental health in order. If you can talk to them, then you can that same conversation be transferred to somebody that has a degree in dealing with these disorders, mental health,
But
anxiety, and depression.
that goes back to a very key point you brought up earlier, is finding somebody you can trust. Because
Mm-hmm.
like I said, in the barbershop, we're around other people that we feel like can relate to us
That's
since
Right.
we
right.
all in that environment. So we're gonna take it from there. But if I go see this counselor that don't look like me, don't live where I live, I feel like they're not gonna understand me.
That's right. That's right. So that's
Um,
why the stigmatization is very
Yeah.
important, even when it comes to crossing those ethnic barriers. We have
Mm-hmm.
to understand that some people, just because of the way they look, that shouldn't hinder us from going to see them. If they got what we need, well, look, we
mhm.
don't go to all black banks, do we?
Nope.
Because
Right.
the money's
That's
still
good.
green, right? Because of where we go, that money's still green. The information that we get from our behavioral health providers is the same way. It's still helpful information, and it doesn't matter where it comes from. But we have to remember that we have to start talking about our mental health in order for people to feel comfortable about seeking help for their mental health, and stop self-medicating with substances, with drugs and alcohol, because that only leads to more problems physically and mentally. Okay, they only put a band-aid on that situation. Okay, so here's your the schedule for your checkups. What you have, when you should have done, and what you should have done. Okay, blood pressure screenings every 1 to 2 years. Does that mean that you should only get your blood pressure checked every 1 to 2 years? No, that means that every year you should have a physical of overall health, but your blood pressure should be monitored daily or weekly to make sure that your numbers are in order. Cholesterol check every 2 to 5 years. No, every year. Okay, every 90 days, every 6 months to every year, you should have your cholesterol checked. Okay, dental exam 6 months to a year. Good. That's a good number. Eye exam 2 to 5 years. That's a good number. Immunizations when they're due. Right, when they're due, you should have it done. Flu and tetanus. Tetanus every 10 years. Flu every year. Okay. Um, self testicular exam monthly. Right, monthly. How do you do that? Okay, if you in the shower, you're already washing down there, right? That's your body, and you're not doing it for excitement. You're doing it for you just
Explore.
it's exploration, right? So you
Right.
want to check, and what you want to do, you want to put them in and rub them between your fingers, your testicles. Those are little round things that feel like little beans or something that's down there in the sack. Okay, you want to rub them. If you feel a knot, something that don't feel normal, a hard spot like a kernel or like a pimple that's in there, then you need to go and get it checked. Okay, and who should do that? Every man. If you got them, check them. Okay. Um, physical exams every 2 to 5 years. I say every year. every 2 years, get a physical exam. Okay, men who are 40 to 65, that's my age group. Okay, blood pressure screenings. Listen, every office visit or at least once every 2 years. Okay, cholesterol screening every 1 to 2 years or as advised. Colon cancer, back up. Colon cancer is very important. Every 10 years, starting the age of from 45 to 50, or earlier if you got a family member that's already diagnosed with colon cancer. Sooner, okay? Dental exam every 6 months. Eye exam every 1 year. Immunization as needed. Physical exams every 1 to 4 years. Prostate. Discuss that with your doctor and do it sooner if you got somebody in your family that's diagnosed with prostate cancer, because that gives you a predisposition for developing prostate cancer. Next. Remember, the healthcare provider is a human being, not a god. They cannot read minds. So, which means you have to talk to them about your problem and let them know what's going on. Okay? Be open with them. Tell them anything. Next. Write down any question that you might have, okay? So that you don't forget what to ask. And don't wait until the last minute to ask the question. Ask it at the beginning of your meeting so they have time to cover it, okay? When you get instruction from your healthcare provider, if you don't understand it, ask them again until you understand it. Make sure that you understand what he's asking you to do before you leave the office, okay? Speak up and be honest about any diagnosis or treatment plans that you have. If you disagree with them, let them know that you disagree with them and ask for another opinion if you need to. But be prepared whenever you go see your provider. Okay. What types of things should I report to my doctor? Any signs and symptoms such as prolonged fever, pain, chest pain, blood in my urine, or etc. Be specific as possible about what you want to ask them, okay, and what you want to report. What is a fever? For adults, 100 plus. For a child, rectal temperature is 104 plus, okay? I always look at the person, not just the thermometer, because there are signs and symptoms of a person that's febrile, which is a cough, vomiting, listlessness, not active, or just like they're out of it, okay? That's what happened with the temperature. Go ahead, next. ER, don't go to the ER unless you have an emergency. That's all I got to say. It's too expensive. It's too time consuming. You could not develop a relationship in the ER, and it puts you at risk for contracting other illnesses while you're in there. Okay. Free clinics. Our clinic is not a free clinic, but we do work on a sliding scale, and we do have a payment to fit everybody that comes to see us. Okay. But go and use these places that you can develop a relationship with a provider. Emergencies, call 911 or go to the emergency room. Okay, that's for any emergency that you might have. And this is a list of them. Okay, how to be healthy. Change some of your basic attitudes and behavior about health. We talked about that earlier. Make your health a priority. Every person is responsible for his or her own health. Okay. Diet. Okay, decrease your salt intake. Stay away from sodas. Moderate drinking of alcohol or just abstain from alcohol, and stay away from substance abuse. But if you do or you know somebody with a substance abuse issue, please contact Caresouth, because we do have resources to help them in their abuse issues. Okay, please. Okay, quit smoking and don't use marijuana. Is not good for you. I don't care if they say it's for herb. It ain't good for you. Okay, marijuana leads to cancer too. Has a high tar intake. Okay. Be careful about excessive stress or anger issues. Once again, mental health. Talk to people. Talk about it. Okay. Think safety first. Exercise. Get cancer screenings. Okay. And once again, that's a list of the ages that you should have these things done. Immunizations. If you need shots, go get them. Tetanus. Remember, every 10 years. Remember your flu every year. If you're over 60, remember pneumonia every 2 years. Okay. The dental health, go see a dentist. Don't be scared of dentists. They're gonna help keep you healthy. They're gonna help you. You'll be able to smile. You ain't got to go buy them fake grills to cover the gaps. Okay, y'all don't see that people got them grills they can cover their gap. All right, so go and take care of your teeth. That's the first defense to your health. Okay, what you put in your body and how you put in your body and how you're able to intake that. Having good teeth and good gums is going to lead to better health. I promise you. This is your dad connection to health. Show your child by example. Be a role model about your health. Okay, genetics. Know where you came from. Know your predispositions to certain diseases. How is it linked to your family? Okay, change your eating habits in front of your children. Don't be going to get the hoagies and the hot dogs all the time, but show them that you can eat a salad, that you can eat that food that they say they'll get with the grill marks on it and the vegetables on the side. Where I want fried chicken, show them something different. Okay, go out and exercise and play with it. Okay, I got a son who's 17. He's 6'3", 200 something pounds. I'm only gonna play certain games with him because he ain't gonna hurt me. I don't heal like I used to. Okay, okay, but make your health a priority. All right. How, if you got questions about your paternity or paternity of a child that you are in possession of, call the South Carolina Parenting Opportunity Program, DSS, at 1-866-914-8786. They can offer or reduce or free or reduced costs for paternity testing if you're not listed on the birth certificate and or agree to be the child's listed father. So you cannot be on the birth certificate and you cannot have agreed to be that child's father, okay? Legally. Okay, testing is done by mouth swab, if applicable, that's accepted as well. Okay, paternity test. Back up one time because I think this is important. One more time. Paternity testing looks at 16 of the human 46 chromosomes to match it. So that's where Murray get it from. You are the father because you have so many links and so many points that y'all match. And so you are the father. And if you've been there and got questions, go get tested to make sure, but make sure that you're taking care of your responsibility. Okay. As a man, it's your responsibility. If you can go out and have fun making that product, then you go out and you enjoy taking care of that product. Okay. Next. The greatest health, the greatest wealth is the greatest wealth is your health. Okay.
That's right.
So you cannot obtain anything if you don't have good health. We went over an hour, but I think we got a lot of information out there. Any questions that you guys have or anything you guys want to say? I'm turning it over to man to man.
Yeah, I'm checking in the chat box now just to see if we had any questions. There was some dynamic information. I got a lot of great information. So we want to make sure that you guys are sharing this and rewatching this. Caresouth, thank you guys so much, man. Daniel and Marik, thank you so much. We look forward to the partnership that we have with you guys. Some dynamic content. So, man, it was just like over the top. So really, really appreciate you guys.
We appreciate you guys.
Like we say, no problem. No problem. Like he was saying, your health is your wealth, right? If you're not healthy, if you can't take care of your family, you know, you can become a detriment instead of being an asset to your family. You don't want to be a liability. We want to be assets, okay? And so how do we become assets? By taking initiative, by taking responsibility and getting educated and like you said, demystify and come against those negative stigmatisms about men and we don't care about our health. Right? We got to make that a number one priority.
That's right.
Number one priority. We are the head of our families, we're the leader of our families, but if we're not healthy, we can't be wealthy. You can't work, you can't provide, you can't, provide the guidance and the nurture that you're supposed to have if you're sick and if you're dying early. Man, some of those stats were mind blowing. Dying 13 to 15 years before our female counterparts.
That's right.
Look what kind of strain you would leave on your family. Look what kind of strain you would leave on that mother. Right? Because you chose to be selfish and not go get checked.
That's right. That's right.
Wow. Yeah.
Any closing thoughts you guys want to share before we log off?
For me, it's just I'm a big advocate of mental health because, like I say, I see a lot of issues that's going on in the world, and even more so now because of COVID. That we've kind of been stuck in a box. We've kind of been stuck at home. Loss of jobs, loss of income, but even loss of just a social life. So I know that's kind of weighing a lot on a lot of people. So, my thing of it is find someone to talk to. Hopefully it's a professional, but at least be able to find someone you can confide in and get some things off your chest, at least.
That's right. Yeah, and I agree. I agree with both of you guys that I feel like during this time, there's a lot of people call it social distancing, and we should never use that term. We should use physical distancing, but our social relationship should remain intact and should remain close. And if we can keep those relationships close, even though we can't be together physically, if we can be together mentally, we can still maintain some type of mental stability. And if you, by some chance, if you lose yourself, do not go out and try to self-medicate using substances or alcohol, find a program or find somebody to talk to before you resort to that. And like I said, if you need help with any type of abuse issue, please get in touch with us at Caresouth. We have a program for you.
Absolutely. I echo everything you fellas said. Talk to someone, get help. And I can stick in the little shameless plug, www.caresouth-carolina.com, or you can reach us on our Facebook page. And also, before I go, I wanted to take a chance to congratulations to Terrence in his Dr. Terrence now, right?
Appreciate that, brother. Yes, sir. Yes, sir.
Yes, sir. Dr. Terrence now. So congratulations, brother.
Wait a minute. I'm not a medical doctor, a PhD. So
Right. PhD, yeah.
don't, listen, I need you guys for that medical advice. So yes, sir.
Yes, sir. All right.
Well, again, thank you guys so much for joining in today. Remember to like, tag, and share. And we can also tune in next week when we'll talk about Men's Health Week 2. I think that's STDs that we'll be talking about. Another sensitive topic that we must discuss in our communities. And when we talked to each other today about, being irresponsible, having multiple partners and not protecting yourself. So we're going to go and dive into some of the ramifications of you not making those wise decisions to protect yourself and not having more than one multiple partner. Okay. So guys, thank you so much for joining us today. Have a great day, and we'll see you next week. Bye-bye.
Yeah, man, it's a